Most home blood pressure readings are garbage. Complete garbage.
Robert, you're scaring people. The readings aren't garbage. The ritual is missing.
Ritual? It's physics, Akira. Arm position. That's it.
And that's exactly why your patients measure wrong every single day. You strip away the context.
Context doesn't change arterial pressure. A full bladder does. Bad cuff placement does. These are mechanical errors.
You know what else changes pressure? Stress from rushing. Anxiety from doing it wrong. The body is not a machine.
Fine. But before we philosophize, let's talk about the 5 mistakes that send millions of people to cardiologists unnecessarily.
Agreed. And I'll show you why each mistake happens when we ignore the human being attached to that arm.
Mistake number 1, the bladder trap. Your bladder is full. You sit down, you measure. Congratulations, you just added 15 points.
In Japan, we teach patients to use the bathroom first. Always. It's not optional.
Because a full bladder increases intra-abdominal pressure, which triggers sympathetic nervous system activation, which constricts your arteries.
Yes, but patients don't remember sympathetic activation. They remember the ritual. Bathroom, then chair, then measurement.
I don't care if they remember the mechanism. I care that they empty their bladder, period.
And that's why they forget, Robert. No context, no adherence. Give them a reason, not just a command.
The reason is 15 millimeters of mercury. That's the difference between normal and hypertensive on paper.
15 points from one simple bathroom visit. Yet how many doctors actually ask their patients about this?
Almost none. Because we assume people know basic physiology. Big mistake on our part.
It's not about knowing physiology. It's about integrating the habit into morning flow. Make it automatic.
Automatic or not, here's what happens when you don't. Your systolic shoots up, your doctor sees the number, and suddenly you're on medication.
Medication you might not need. All because of timing and sequence. This is what I mean by ritual.
All right, mistake number 2, talking during measurement. People love to chat while the cuff inflates. Destroys everything.
This one frustrates me deeply. Silence is not rude. Silence is respect for the measurement process.
When you talk, your vocal cords vibrate. Your chest muscles engage. Your diaphragm moves. All of that creates noise in the reading.
And patients don't realize they're sabotaging their own data. They think conversation is harmless.
It adds 10 points easily. Sometimes more if you're arguing with someone or explaining something complex.
In our clinics, we place a small sign, silence during measurement. Not as a rule, but as a partnership.
Partnership sounds nice, Akira, but I just tell patients flat out. Mouth closed, cuff inflates, we get truth.
Your approach works for compliant patients. Mine works for the ones who need understanding before they comply.
Fair enough, but the physiology doesn't care about feelings. Talking equals bad data. End of story.
The physiology also responds to stress. If your blunt approach makes someone anxious, you still get bad data.
Then let's move to mistake 3, arm position. This is where I see the most catastrophic errors.
Catastrophic is accurate. I've seen patients with arms dangling, arms overhead, arms twisted behind chairs.
The rule is simple. Arm at heart level, not above, not below, exactly at the midpoint of your sternum.
Simple in theory, but show me the average dining room table that matches heart height perfectly.
You don't need perfection, you need close enough. Use a pillow, a folded towel, a book. Just get it level.
And if the arm is too low, what happens to the reading?
Gravity pulls blood down, increasing hydrostatic pressure at the brachial artery. Your reading goes up artificially by 8 to 10 points.
And if too high, the opposite. Reading drops because you're fighting gravity. False reassurance.
Exactly. I had a patient, Margaret, who measured 160/95 every single morning for 6 months.
Let me guess. Her arm was resting on a low armrest the entire time.
Worse. Her arm was hanging off the side of her chair with no support at all. Pure dead weight.
That's not just bad technique. That's suffering. 6 months of worry. Doubled medication. Unnecessary stress.
And the moment we corrected her arm position, supported it properly at heart level, her pressure dropped to 125/80.
Same person, same body, different ritual. This is what happens when we teach mechanics without meaning.
The meaning is irrelevant if the arm is in the wrong place. Mechanics first, philosophy later.
Philosophy ensures the mechanics happen consistently, Robert. Your way gets 1 correct reading. Mine gets 100.
Then we agree on the goal. Now let's talk about mistake 4, coffee and stimulants.
The morning ritual killer. Coffee before measurement is nearly universal.
And it wrecks everything. Caffeine constricts blood vessels within 15 minutes, peaks at 30 minutes, lasts for hours.
In Japan, we tell patients, measure first, enjoy tea second. The order matters more than the drink.
Because if you reverse it, your systolic jumps by 10 to 15 points. You're not measuring baseline, you're measuring stimulation.
And yet, how many people wake up, brew coffee, sip it while reading news, then casually check their pressure?
Almost everyone over 60. They don't connect the dots between the cup in their hand and the spike on the screen.
This is why we teach the 30-minute rule. No caffeine, no smoking, no stimulants for 30 minutes before measurement.
30 minutes minimum. Some studies suggest 60 for heavy coffee drinkers, but good luck getting compliance on that.
Compliance improves when we frame it as protecting their data, not restricting their pleasure.
Data protection. I like that, because bad data leads to bad treatment decisions.
Exactly. A false high reading means unnecessary medication. A false low reading means missed danger.
Which brings us to mistake 5, random timing. People measure whenever they remember. Morning, noon, night, doesn't matter.
But blood pressure follows circadian rhythm. It's lowest during sleep, rises sharply in morning, peaks mid-morning, drops in evening.
So if you measure at 7 a.m. one day and 2 p.m. the next, you're comparing apples to jet engines.
Jet engines. I'll remember that one. The point is consistency. Same time, same conditions, same ritual.
I tell patients to pick one time and obsess over it. Set an alarm. Make it non-negotiable.
I tell them to link it to an existing habit. After waking, before breakfast. Anchor it to something automatic.
Anchoring works, but only if the anchor itself is consistent. If breakfast time floats around, the measurement floats too.
True, which is why we encourage morning routine structure. Wake, bathroom, measurement, then freedom.
Freedom after data. I can live with that.
So we've covered 5 mistakes. Full bladder, talking, arm position, coffee, and random timing.
5 simple errors that create massive confusion, and most doctors never check for them.
Because we assume patients know. But assumption is the enemy of accuracy. We must teach the ritual.
Now let's talk about what actually happens when you do it right. The perfect measurement protocol.
Perfect is a strong word, Robert. But yes, let's give people a clear sequence they can follow.
Step 1. Wake up. Don't check your phone. Don't start your coffee. Go straight to the bathroom.
This is where ritual begins. The body wakes. The bladder empties. The mind stays quiet.
Step 2. Sit in your measurement chair for 5 full minutes. No movement, no phone, just sitting.
5 minutes feels long to Americans, I know. But this is where the sympathetic system calms down.
Your heart rate drops. Your vessels relax. You transition from sleep state to stable baseline.
Without this rest period, you're measuring transition, not baseline. The numbers lie.
Step 3. Position your arm. Supported surface. Elbow bent 90 degrees. Cuff at heart level exactly.
Use a pillow if needed. Use a folded blanket. Whatever brings the arm to proper height comfortably.
Comfort matters because tension in the shoulder or neck will spike your reading. Relaxed arm, relaxed body.
And feet flat on the floor. Not dangling, not crossed. Flat and grounded.
Crossed legs compress the femoral artery, which increases resistance and drives up the systolic number.
Small detail. big impact. This is why checklists help. The mind forgets under routine.
Step 4. Apply the cuff correctly. 2 fingers of space between cuff and skin, not loose, not tourniquet tight.
And the bladder of the cuff, the inflatable part, centered over the brachial artery, not rotated to the side.
If the bladder sits off-center, you're compressing the wrong tissue. Your reading becomes nonsense.
Nonsense that leads to panic. I've seen patients convince themselves they're dying from one bad cuff placement.
Step 5. Silence. Close your mouth. Breathe normally through your nose. Do not speak, do not move.
This is the meditation moment. Not spiritual, practical. The body reveals its truth in stillness.
And when the cuff inflates, don't tense up. Don't hold your breath. Just let it happen.
Holding breath is surprisingly common. People fear the squeeze. But tension ruins everything.
The squeeze lasts 15 seconds. You can handle 15 seconds of mild discomfort for accurate data.
Accurate data that might save your life, or save you from unnecessary medication. Worth the squeeze.
After the first reading, wait 1 minute. Then take a second measurement. Average the 2.
1 reading is a snapshot. 2 readings are a pattern. Patterns are what doctors need.
If the 2 readings differ by more than 5 points, take a third. Something was wrong with the technique.
Usually the first reading is higher. The body adjusts to the process. The second is more reliable.
Which is why we average. It smooths out the noise and gives you a clearer picture of what's real.
Real is what we're after. Not perfection, not one-time luck. Consistent reality.
Now, what about people who still get high readings after doing everything correctly?
Then the reading is real, and we investigate further. White coat hypertension, chronic stress, diet, genetics.
White coat hypertension is real. Blood pressure spikes in medical settings, even when home readings are perfect.
Because the environment triggers anxiety. The white coat, the sterile room, the authority figure watching.
That's why home monitoring is so valuable. It removes the anxiety variable and shows us the true baseline.
But only if home monitoring is done correctly. Otherwise, we trade white coat hypertension for technique hypertension.
Technique hypertension. That's good. I'm stealing that term.
Steal away. The point is the same. Bad process creates false data, and false data creates bad medicine.
Let's go back to Margaret for a second. Her story illustrates something important about doctor responsibility.
Margaret, the one with the arm position error. What happened after you corrected it?
We rechecked her pressure in the office with proper technique. It was normal. Her medication was cut in half immediately.
6 months of double medication. 6 months of side effects. 6 months of unnecessary worry.
Because her original doctor never watched her measure at home, never asked about her setup, just trusted the numbers.
This is the failure of modern efficiency. We want data fast. We skip the observation. We miss the truth.
I now make every new hypertension patient demonstrate their home measurement technique in front of me.
How often do you find errors?
8 out of 10. 80% of patients do something wrong. Arm position, talking, wrong cuff size, you name it.
80%. That's not patient failure. That's system failure. We never taught them properly.
We handed them a device and said good luck. No training, no follow-up, no verification.
And then we blame them when the numbers don't make sense. This is backwards.
Completely backwards. The burden should be on us to teach, not on them to guess.
So what do we want people to take away from this conversation?
5 mistakes to avoid. Full bladder, talking, wrong arm position, coffee before measurement, and inconsistent timing.
And 1 ritual to adopt. Wake, bathroom, 5-minute rest, proper position, silence, 2 readings, record data.
If your current readings are high, don't panic. First, fix your technique. Then remeasure for 1 week.
Bring that week of clean data to your doctor. Let them see the pattern, not just one random number.
And if your doctor dismisses your concerns about technique, find a new doctor. This matters too much.
It matters because blood pressure is not just a number. It's a window into cardiovascular health.
A window we can only see through if the glass is clean. Bad technique is a dirty window.
Beautiful metaphor, Robert. I might steal that one.
Steal away. Just measure your blood pressure correctly afterward.
One more thing. For people who feel overwhelmed by all these steps, start with just one change.
Agreed. Pick the mistake you're definitely making and fix that first. Usually it's arm position.
Or coffee. Many people can't imagine measuring before their morning cup. But try it once. See what happens.
You might discover your pressure was never actually high. It was just caffeinated.
And if it's still high after correction, then you have real data to work with. That's progress.
Real data leads to real solutions. Fake data leads to fake solutions that don't work.
Which is why we spent 20 minutes talking about something as simple as sitting in a chair correctly.
Simple, but not easy, and definitely not obvious. That's why this conversation matters.
Thank you for pushing me on the details, Robert. And thank you all for listening. Measure wisely.